Symptoms: depression in adults. The symptoms of depression can be complex and vary widely between people. If you're depressed, you may feel sad, hopeless, and lose interest in things you used to enjoy. The symptoms persist for weeks or months and are bad enough to interfere with your work, social life, and family life. There are many other symptoms of depression, and you're unlikely to have all of those listed on this page. Psychological symptoms. The psychological symptoms of depression include continuous low mood or sadness, feeling hopeless and helpless, having low self-esteem, feeling tearful, feeling guilt-ridden, feeling irritable and intolerant of others, having no motivation or interest in things, finding it difficult to make decisions, not getting any enjoyment out of life, feeling anxious or worried, having suicidal thoughts or thoughts of harming yourself. Physical symptoms. The physical symptoms of depression include moving or speaking more slowly than usual, changes in appetite or weight, usually decreased but sometimes increased, constipation, unexplained aches and pains, lack of energy, low sex drive, loss of libido, disturbed sleep. For example, finding it difficult to fall asleep at night, or waking up very early in the morning. Social symptoms. The social symptoms of depression include avoiding contact with friends and taking part in fewer social activities, neglecting your hobbies and interests, having difficulties in your home, work, or family life. Severities of depression. Depression can often come on gradually, so it can be difficult to notice something is wrong. Many people try to cope with their symptoms without realizing they're unwell. It can sometimes take a friend or family member to suggest something is wrong. Doctors describe depression in adults as either less severe, mild, or more severe, moderate or severe, based on the symptoms, including how often you get symptoms and how bad they are, how long depression lasts, the impact on your daily life. A few people with severe depression may have symptoms of psychosis. You'll usually be asked to answer a set of questions to help doctors assess how severe your condition is. Grief and depression. It can be difficult to distinguish between grief and depression. They share many of the same characteristics, but there are important differences between them. For some people, bereavement can lead to depression. If you're grieving, it's normal to have feelings of sadness. Some other symptoms of depression are rare with grief and bereavement, such as having suicidal thoughts, symptoms of psychosis, and feeling hopeless or guilt-ridden. Read more about coping with grief after bereavement or loss. Other types of depression. There are different types of depression, and some conditions where depression may be one of the symptoms. These include postnatal depression. Sometimes new mothers, fathers, or partners develop depression after they have a baby. This is known as postnatal depression, and it's treated in a similar way to other types of depression, with talking therapies and antidepressant medicines. Bipolar disorder, also known as manic depression. In bipolar disorder, there are spells of both depression and excessively high mood, mania. The depression symptoms are similar to depression, but the bouts of mania can include harmful behavior. Seasonal affective disorder, SAD, also known as winter depression. SAD is a type of depression with a seasonal pattern usually related to winter. Premenstrual dysphoric disorder, PMDD, a severe type of premenstrual syndrome, PMS, where you have symptoms including feelings of depression and anxiety in the weeks before your period causes. There's no single cause of depression. It can occur for a variety of reasons, and it has many different triggers. For some people, an upsetting or stressful life event, such as bereavement, divorce, illness, redundancy, and job or money worries, can be the cause. Stressful events. Most people take time to come to terms with stressful events, such as bereavement or a relationship breakdown. Personality. You may be more vulnerable to depression if you have certain personality traits, such as low self-esteem or being overly self-critical. This may be because of the genes you've inherited from your parents, your early life experiences, or both. Family history. If someone in your family has had depression in the past, such as a parent, sister, or brother, it's more likely that you'll also develop it. It's thought that severe depression in particular may be partly caused by the genes you inherit from your parents. Pregnancy and giving birth. Some women are particularly vulnerable to depression after pregnancy. The hormonal and physical changes, as well as the added responsibility of a new life, can lead to postnatal depression. Sometimes depression starts before you give birth. Depression in pregnancy is known as antenatal depression. Menopause. Menopause is when your periods stop due to lower hormone levels. Sometimes menopause can trigger depression, particularly in the first few years. Loneliness. Feeling lonely, caused by things such as becoming cut off from your family and friends, can increase your risk of depression. Alcohol and drugs. When life is getting them down, some people try to cope by drinking too much alcohol or taking drugs. Drowning your sorrows with a drink is also not recommended. Alcohol affects the chemistry of the brain, which increases the risk of depression. Head injuries are also an often under-recognized cause of depression. A severe head injury can trigger mood swings and emotional problems. In some people, an underactive thyroid, hypothyroidism, can cause depression.